Well, summer is here, and if you are struggling to get into that bathing suit or favorite pair of shorts, your hormones may be to blame.
Yes, as part of Wellness Wednesday, we turn to Avexia's Health Solutions and Inspire Medical Wellness. Sylvia Castaneda headed out to Mount Juliet to learn about why we might struggle to lose weight.
Back with us is Dr. Jason Burchard of Inspire Medical Wellness here at Mount Juliet. And thanks so much for inviting us out to the clinic today.
Absolutely, our pleasure.
Okay, let's talk weight loss. It is always such a huge topic. Talk to us about how hormones play a role in either us gaining weight or losing weight.
Of course, I love that question because hormones are the chemical messengers that our metabolism have to have. Our metabolism is a hormone-centric system. And the challenge that we run into with so many of our hormones, Sylvia, is they change as we go through life. And there's so many variables in why they change and when they change, but just it's pretty much expected that for men and women both, by the time we get on into our sometimes as early as our late 20s, but for sure by our 30s, the metabolic performing hormones, our fat burning hormones, start slowing down. And as a result of that, it's the reason why that so many people find that the things they used to do to get weight off, I'm gonna eat less, I'm gonna move more, even introducing the fat burners that we know are popular today, a lot of times we find that that still doesn't have the impact that maybe it once did or that we're expecting that it would have.
So people who are struggling with losing weight, even though they're eating healthy, they're exercising, is there a hormonal component that maybe is being overlooked?
Well, quite often there is. And that's where that, to your point, we always talk about, of course what we eat it matters, right? The dietary lifestyle is a big part of what we evaluate when we're working with a patient, their calories, their macronutrients, exercise as well, that our movement is important. And then we've talked a little bit about in other segments, but obviously the crave of different fat burners today and appetite suppressants, all of that plays a role. It all has a piece in this puzzle. But again, so much of that, at the end of the day, none of that stuff really can fix or overcome an unhealthy aging metabolism.
Now, what about the medical fitness and weight loss plan here at Inspire Medical Wellness? How does it differ from standard diet and fitness plans?
Sure. Probably the best way to answer that would be to say that we take a very inside-out approach to this. Sadly, and statistically speaking, so many people struggle with sustaining the weight they lose. In a lot of situations, we can get weight off by, again, eating less, moving more, but the sustainability, most studies show that about 90% of the time, the weight that we lose, we just eventually gain back. And so much of that comes back to there's underlying issues that are not being addressed. So we want to take that inside out approach. I always refer to it as we have to fix the foundation first.
Doctor, that makes so much sense. And I know that you have an amazing patient story, a patient of yours who lost 75 pounds. So let's listen in.
So it seems like the weight came on really quick. I had quit smoking, which then I, in return, started eating. So food was my crutch. Then I just went up to almost 200 pounds and knew I needed to do something. When I started working at Inspire, I seen how it changed people's life. And I'm like, sign me up. So I did lab work. They went over the labs with me and said, this is what we can customize for you. I followed that plan. And then every week, the weight just started coming off. They make it easy. A year later, I lost 75 pounds. Before Inspire Medical, I felt old. After, I feel alive. I feel me again. It's amazing what they do here. We change people's life, we truly do. And it's not because I work here. I see it every day. Come see us. Give us a chance. I want to share my story with you. Inspire Medical can change your life.
Doctor, what an amazing story with Connie, and I love that she now shares her story with people who are walking and feeling hopeless. and telling them, you know, you can turn things around and you can lose weight effectively. So talk to us about folks who are watching now thinking, you know, I don't feel like myself. I feel like I need help. What's the first step for them getting answers?
Well, the first step would be simply to give us a call. We'll get you scheduled a complimentary consultation to come in and sit down and have a one-on-one conversation. It's really important to know there's no one-size-fits-all to how we approach this. And then we're going to do a deep dive, again, from the inside out. We're going to get the necessary blood work, make sure that those metabolic markers are in their optimal position. If they're not, we're going to obviously address those. Pair that with the correct dietary lifestyle that makes sense for that particular individual. And then we can start to talk about, and we do, the fat burners and appetite suppressants that can play a role in this, as long as, again, that those are used properly. We just have to understand that they're just playing one piece of the puzzle. So again, it's a very comprehensive one-on-one approach, but that's the first step.
And personalized approach too, right?
Absolutely.
Well, doctor, thank you so much for sharing this valuable information with us. And we so appreciate you inviting us out to see where you do your work.
Of course, thanks for coming.
We're going to send it back to the studio.
All right, thank you, Sylvia. To learn more about weight loss and hormone replacement therapy, or to make an appointment, visit inspiremedicalwellness.com. You can also visit avexius.com and then click on Find a Provider.